basic things like safety locks on guns so the kids can't play with them? Are we going to do anything basic like identifying people who should not even be considered owners of guns and take advantage of the gun store loophole? This, to me, is a fundamental issue, and it is a public health issue. It involves not hairstyles, it involves death by gunshot.
And by the way, they call it a public health crisis because they want to put supposed experts in charge of disarming. The Second Amendment in the Bill of Rights is not a public health crisis.
That's a little bit of the back and forth from a U.S. Senate Judiciary Committee hearing yesterday on, quote, gun violence and the public health crisis that some say it is. Welcome in, Bishop on Air here with you on this weekday morning. You can follow along. Just search Bishop on Air on Facebook, YouTube, X. You can like, subscribe, and get that notification bell on YouTube. The number of subscribers continues to grow, and I'm definitely appreciative of that. But efforts to cast gun violence as a public health crisis getting some pushback in the U.S. Senate, as this was a subject matter hearing yesterday in Washington, D.C., where you had experts that Democrats brought forward and experts that the minority Republicans in the Senate brought forward to discuss the issue of violent crime being committed with a firearm. And we'll also touch on some of the statistics that there are, and as far as lawful gun owners and how much of them are the problem. But some interesting conversation had. Let's go ahead and jump right on into it. One of the chairs of the Senate Judiciary Committee, Illinois Senator Dick Durban, he started off with some statements and made his voice heard on the issue of violent crime, of individuals using a firearm. Some deem that a term called gun violence, but there's a lot of pushback on that rhetoric. So here's what Senator Durban had to say about the idea of just, keeping people safe.
It starts with the knowledge that when that child goes to school, he's going to come home safe at the end of the day. If you can't answer that question affirmatively, what in the hell are the rest of the questions worth? This, to me, is a fundamental issue, and it is a public health issue. It involves not hairstyles, it involves death by gunshot. And it's going on in America every single damn day. And we have a responsibility to do something up here. Not just to say we need to fund the police more. I'll sign up for that. We need to deal with mental health counseling. I'll sign up for that as well. But are we going to do some basic things like safety locks on guns so the kids can't play with them? Are we going to do anything basic like identifying people who should not even be considered owners of guns and take advantage of the gun store loophole? That, to me, is an example of what we can do that's just common sense.
So again, the senator talking about what he calls common sense gun control. And he goes on to talk about other states that may be Republican-led that he says are taking steps to issue regulations on the legal ownership of firearms.
Some states have taken a lead on this, and some may be surprising. Is there any restriction on buying a gun in the state of Wyoming, one of the most Republican states in the United States? Yes, turns out they have a state law that says you have to be 21 years of age. We're still debating this on a national basis. Even a conservative Republican state like Wyoming thinks that makes common sense.
But that's something that's being challenged in the courts, and the U.S. Supreme Court could very much be the final determinant factor as to whether or not you can restrict the ownership of firearms to adults under the age of 21. And that's already been litigated to a degree in some of the courts across the country. So clearly, these types of ideas may just run afoul of the U.S. Constitution and the Second Amendment of the Bill of Rights, a civil liberty. So after hearing some of the language that was used, things like gun violence or trying to label violent crime with firearms as a public health issue, Senator Ted Cruz, he fired back pretty succinctly.
Today's Democrats, when it comes to guns, their objective is to disarm law-abiding citizens. They simultaneously embrace policies that release violent criminals from jail. They're not interested in locking up murderers. They're not interested in locking up gangbangers. They're not interested in locking up violent criminals. Instead, they systematically support policies that release violent criminals. By the way,
so Cruz goes on to talk about the various issues around addressing crime and the lack of some prosecutors across the country in large urban areas not wanting to go after crime. He even said that that's turned some Democrats into Republicans because the now Republicans who switched party say that the Democrats are just focused on the wrong issues here. Instead of going after the criminals and holding criminals accountable, you see efforts to essentially restrict firearms and the ability for law-abiding individuals or just non-violent individuals, because you do get into the issue of if you keep using that term law-abiding, well, what about if you go over the speed limit? You're breaking the law. If you do that, are you not a law-abiding citizen? So, you got to kind of, I guess, be really specific when you're talking about individual rights. But Cruz went on to address some of the other issues that he talks about are really the problem here when it comes to violent crime using firearms.
we have a mental health crisis in this country. I've repeatedly introduced legislation to improve school safety, to invest to double the number of police officers in schools. Democrats objected. To invest $15 billion in mental health counselors in schools. Democrats objected. Their priority is not stopping the criminals. Their priority is disarming law-abiding citizens. And by the way, they call it a public health crisis because they want to put supposed experts in charge of disarming you. The Second Amendment in the Bill of Rights is not a public health crisis. What is a public health crisis is the crime rates that are skyrocketing because Democrats keep letting murderers and violent criminals out of jail.
So again, Cruz goes on to discuss this issue, saying that there's some false choices being presented, that you have to go after gun control in order to curb this, when he says there's a mental health issue that needs to be focused on. You had some of the experts there, including Amy Swearer. She is a attorney with the Heritage Foundation, does deep dives into a whole host of things. And she shared some of her thoughts as experts in front of the Senate Judiciary Committee yesterday.
Put aside that the end goal of many of those pushing the public health framing is often either to use crisis language as an end run around the Constitution or to pathologize the right to keep and bear arms. Put aside, too, that the public health lens is not particularly useful for understanding and addressing a problem that stems at its core not so much from a lack of insight into how violence affects health as from a lack of adequately enforcing criminal laws and utilizing existing mental health frameworks. If we take the issue of gun violence seriously from a public health perspective, none of the problems or solutions have changed. A public health framework doesn't change, for instance, the fact that most gun crimes are perpetrated not by ordinary lawful gun owners, but by a small subset of repeat offenders who are already prohibited from owning guns. It's still the case that if our policing, bail, and prosecutorial policies immediately spit these repeat violent offenders back into the community without pursuing criminal prosecution or punishment, they will predictably keep committing violent crimes.
She goes on to lay out a whole host of issues when it comes to violent crime and the foul lines that could be crossed if somebody tries to implement gun control efforts that could run afoul of the Second Amendment. And again, how often have we talked about the myriad cases there are, not just in Illinois, challenging the magazine and gun ban here in this state and the registry, which, by the way, really haven't seen any updates. We'll try to get some of that out for you as those updates happen. But in the litigation against Illinois' gun ban and registry. But she also later on in the Q&A with some of the senators talked about previous research the Heritage Foundation had done in other states where individuals' concealed carry licenses may have been revoked, and how the total number of a state's concealed carry license being revoked, those who got the concealed carry license and the very small, minuscule, percentage of those who had them revoked. She says it goes on to show that the individuals who are gun owners going through it in the proper channels are not the problem. And something I guess that kind of highlights some of that as well is from Illinois State Police. They released earlier this week a clear and present danger report. And these are the reports that Illinois State Police file on individuals, or local law enforcement can file on individuals. And it pretty much says that somebody's a clear and present danger, and they shouldn't have access to a firearm, so it could prohibit them from getting a firearm owner identification card. And in the state of Illinois, that's required for you to own and buy handguns, rifles, shotguns, and ammunition. If you don't have a FOID card and you're in possession of any of the firearms or ammunition, you're violating Illinois state law. But you see here that Illinois State Police talked about, the clear and present danger reporting system and going through and receiving a total of 10,144 clear and present danger reports from law enforcement, school administrators, and medical professionals, resulting in 4,212 FOID revocations or application denials. So of the 10,000 reports submitted, 4,900 individuals did not have a FOID card. So you could see here that, compare this number, 4,200 FOID revocations or application denials. Thinking about how there are 2.4 million FOID card owners in the state of Illinois, and looking back at that number of 4,200 revocations based off clear and present danger reports, that's comparable to the number of people who have registered firearms, and that right now is a little over 4,000, so that's 0.17%. So this is right about 0.18% of FOID card owners who have had some kind of clear and present danger report against them having their card revoked in the state of Illinois. That's minuscule. That's not even, a 0.5% of total FOID card holders. So some may see that as an indication that it's not those who are going through the proper channels that are the problem when it comes to firearms being used in violent crimes or being, quote, clear and present danger. But anyway, I just wanted to highlight some of that because that, of course, is interesting reporting from the Illinois State Police that they put out about the clear and present danger reports. But back to the U.S. Congress with the Senate Judiciary Committee. Amy Swearer from the Heritage Foundation talks about some of the regulations that have been proposed and how she says, quite frankly, that's just not going to solve some of the problems.
It certainly doesn't change the fact that most of the gun control restrictions commonly proposed to deal with criminal violence and suicide, things like assault weapons bans, magazine capacity restrictions, punitive public carry laws, and so on, are not even remotely designed to meaningfully address any major factors underlying crime or suicide. And a public health lens doesn't fix the constitutional or practical concerns about implementing these policies, nor does it erase the fundamental importance of the right to keep and bear arms to the natural right of self-defense.
So that conversation went on. It was about an hour and 20-minute long committee hearing yesterday. The Democrats had their experts there as well. Here is Dr. Megan Ranney. She talked about, seeing gunshot victims firsthand and treating all kinds of individuals who have been victims of violent crime by way of somebody using a firearm. And she said that, there needs to be regulations, similar to the regulations there are on vehicles and drunk driving.
Despite more cars being on the road, by quantifying the problem, identifying risk factors, developing multifaceted solutions ranging from reducing drunk driving to putting airbags in cars, and then by scaling what worked. Unfortunately, we have not yet consistently applied this approach to firearm injury. As a result, we are facing a growing epidemic. America's total number of gun deaths is the highest on record, and our rate nears its peak. Firearm deaths have surpassed breast cancer deaths in America. Firearms are now the leading cause of death for American children age 1 through 19. Although mass shootings get the most media attention, 2/3 of firearm deaths are preventable suicides, averaged over the last decade, like that young man I cared for 15 years ago. The remainder are mostly community violence and, to a lesser extent, domestic violence.
So she goes on to talk about some of the things that she wants to see implemented and in order to better attack what she says is a public health crisis.
First, help us get better data so Americans can better measure, predict, and evaluate this health crisis. You can make this happen, whether by funding data modernization for the CDC or by removing barriers to data sharing amongst state, territorial, and local partners, as Utah has done. Help us with federal funding for research to develop and evaluate solutions. At a minimum, continue current levels of appropriations for the NIH and CDC, but ideally appropriate more. Help us by supporting our scaling up and training of folks on things that do work. I'm happy to talk about this in Q&A. And finally, help our country have hope by demonstrating collaborative action, as you have done before.
So a lot of different points being made by all sides in this. And then some of the Q&A got interesting. Here's Senator Kennedy from, I think he's Louisiana, questioning Dr. Megan Rainey about, or is it Rainey, about, well, violent crime in some of these jurisdictions like the city of Chicago.
Why do you think that Chicago has become America's largest outdoor shooting range? Do you think it's because of Chicago citizens who have no criminal record, but who have lawfully a gun in their home for protection or perhaps for hunting? Or do you think it's because of a finite group of criminals who have rap sheets as long as King Kong's arm?
So Mississippi, Louisiana, and Missouri actually have higher firearm death rates. Obviously, there's certain...
What about Chicago?
So I don't live in Chicago. It's not my primary area of research.
You don't have an opinion on that?
I think there's easy access to firearms combined with environmental conditions, lack of great education. There have actually been studies showing that when you green vacant lots and repair abandoned buildings in urban neighborhoods, you see decreases in gunshots, in violence, as well as in stress and depression in the neighborhoods around them.
No disrespect, Doc, but that sounds a lot like word salad to me.
So again, that was just some of the back and forth yesterday at a U.S. Senate Judiciary Committee hearing on trying to cast, quote, gun violence as a public health emergency. And all that after we saw what happened, was it New Mexico, where the governor there tried to implement a public health emergency restricting individuals' ability to carry firearms. And that was quickly in the courts shot down. So, yeah, is that a tactic that's going to be used here? Trying to label gun violence as a public health concern and implementing executive orders. We saw what public health concerns around the COVID-19 virus brought about for well over 2 years during the pandemic, and all of the restrictions there were on First Amendment rights of gathering, of people being able to go to school, people being able to, say they don't want a certain type of medical treatment in order to keep their job. So all of that being done through the guise of, public health. And that's mean that we're going to see some kind of efforts to continue casting this issue as a public health crisis instead of as a issue of, bringing about more moral society and ensuring that people get the mental health treatment that they need and so on. Well, we'll keep a close eye on all of that. All right, appreciate you guys tuning in.